When rallying support for the campaign, is the minister personally aware that many clinics do indeed operate with the unsupervised and unlicensed technologists? I know the point was raised earlier that there are individuals who have failed the exams multiple times, and is this something that the Minister of Health is aware of?
Perhaps I can jump in and answer that one. I am not sure that the current minister is really aware of all of these issues, quite frankly. What we've been finding through the process, there is a regulatory branch in the ministry, in Victoria, in the Ministry of Health. And that regulatory branch, there are two individuals who have the responsibility for professional regulation within the system. I am not sure that the information that we're trying to get out across the province is really getting through to the minister. I think that perhaps it's been screened off before it even gets to the minister or the deputy minister for that. And I think if the minister really understood this issue, really understood that these professions are asking for self-regulation, it's not something that is being dictated to them. It's the professions themselves that are asking for it. And I really do believe that if the minister honestly understood a lot of the issues, understood the risks, understood the risk to patient safety in the long term because of this, I think he would probably be a lot more supportive than we have seen in the past. Past health ministers have been somewhat uncaring, I think, in terms of addressing this issue. But again, I think if we were to take the Minister of Health and take him through a major laboratory in one of the major hospitals in the healthcare system, or if we were to take him through the radiology department in one of the major hospitals and actually see what technologists do and see how important they are to the system and see the impact that they have upon patient safety, upon patients getting the right diagnosis and treatment, I think if the minister were really aware of how complex our technologies are and how important this issue is to the future of technology in the healthcare system, I think that he would probably have a totally different opinion. But I'm really not too sure that that information is getting through to the minister. I tend to feel it's being somewhat screened along the way.
We've been trying for the last 3 or 4 months to get a meeting with the minister. With the patientsafetyrstbc.com website, over 475 letters have been sent to him expressing concern for this issue. But to this point, what we're getting is the minister has other alligators in his swamp, and he has to deal with those, and basically we'll keep trying. We'll keep trying to get our positions through to the minister.
I think what confounds us all a bit is I know in October 2001, so just over 10 years ago, the Health Professions Council said yes, cardiology technologists need a regulatory college, and we have been working to try to fulfill that statement ever since, but we just keep running into roadblocks. And as Darlene alluded to earlier, part of it is that there have been difficulties with some of the colleges out there. And I think everybody that's sitting at this table and a few members that are not here are keen on working with and establishing maybe a different type of college council society, as long as there's that regulatory factor into it, that we can make sure that patient safety is coming first. And looking at possibly doing a new way to have colleges so that it really is about the public. But you would still have the associations that are there and able to best service their own members individually. And as Malcolm had said, we're looking at some type of funding thing that the associations would automatically be getting a set portion of those dues so that the associations are self-sustaining. And again, our own members and the technologists will still have a body that is solely looking out for them. So we're trying to address it from two ways. One from the public way, but also looking at the technologists and their needs and what they need to be safe working in the hospital, being competent in their jobs, but that anybody coming in to have a test also knows that they have safety as their first consideration.
Great, thank you. I just want to come back to Darlene's point quickly. She mentioned that in terms of making the minister aware that we have established a Mail the Minister function on the Patient Safety First microsite. That's patientsafetyrstbc.com, in which you as well can express your concerns regarding patient safety as we hope to make the Minister of Health aware of this issue.